My name is Dr. Latif Salam. I'm an attending physician here in the Department of Medicine at Downstate Medical Center. I'm an internal medicine physician, and I work in a section of hospital medicine. I'm an academic hospitalist, and I provide teaching to medical students and the medical residents in our training program. After high school, going into college, I took a lot of different roads, but all kind of led me to medicine. So my parents kind of pushed me into it, and I knew I was always interested in the sciences. And, here we are. When I wanted to be a doctor, one of the things that motivated me was taking care of the people in my community. That's exactly what I'm doing here. I'm taking care of people who are Black, Caribbean, African, and a lot of times when they see a face like myself, they can relate to me, and it makes the rapport that much better between myself and the patients. People that we take care of here are people who come from marginalized backgrounds, low socioeconomics, and we're taking care of people who are very ill. And just giving them a chance to get healthier or a chance to live is something that's very rewarding. It's true that there is a mistrust between, a lot of Black patients and physicians. I believe 8% or 9% of doctors, practicing physicians in the country are minorities, i.e. Black or Hispanics, and there's not many of us. So I think when I take care of patients who are Black or minorities, when they see a young man like myself, I think it just gives them that much more comfort and confidence to kind of open up and speak to me, because when they see a young man like myself, they assume that I have their best in mind and that I'm not going to do anything malicious. And it just makes life easier for myself, and it makes the job that much more enjoyable and fulfilling. I was born in Nigeria, born and raised in Nigeria. I came to America when I was about 9-10 years old. Been in Brooklyn since. So I think my definition, I'm a true African American, because I was born in Africa, but I really was raised and bred in America. I came here after residency training, and I've been here for a few years now. And it's been a very, very pleasant one. The experience has been nothing short of joyful. I've met a lot of people who have kind of took my hands and have been mentors to me and helped me, kind of find a path on where I want to go, the things I want to do. I work in a great department. My coworkers are fantastic. We learn from each other. We work with the medical residents. And Downstate has given me the opportunity to try to recruit the next minds, the next doctors. You are the company you keep. I think it's like 3% of practicing physicians are Black male. So I always say I'm one of 3%, which is a very, minuscule number. So, when I step into a hospital, wherever it be, I just put my best foot forward. It starts with the way I look, because people tend to assume you work a certain field if you're, a young Black man. I've been mistaken for a food carrier in the hospital before, and I always tell them the story. So that's one of the reasons I take my appearance into heart. When I step into the hospital, I make sure I look good, and you're not going to mistake me for anything else than what I am, which is a physician. I know how it is to be a Black man in medicine. There's not many of us. So one of the things that I want to leave here as an impact is to get in touch with the young Black men who want to be a doctor, who want to do internal medicine. I want to be somebody that they can look to, they can call, they can send an email, they can speak with. And I can kind of explain the road and the challenges and let them know that this is what you need to do to get to where you want to be.